everybody, welcome back to my class. Today we will study external treatment. External treatment for injuries refers to the treatment of the local injury. We know the development of external treatment of the whole traumatology has a long history and great characteristics and plays an important role in traumatology treatment. The drugs for external use in traumatology refers to drugs applied to the local injury sites. Clinical drugs for external use can be broadly divided into application drugs, liniment, fumigation with application, and iron drugs. So the first is application drugs. The most used dosage forms of drugs for external use are plaster, ointment, and powder. When used, the pharmaceutical preparation is directly applied to the injured site to make the drug effective, which can achieve better efficacy. So, the first is ointment, also known as application or ointment. When preparing of ointment, grind the drug into fine powder, then add melt sugar, honey, oil, water, fresh herb juice, wine, vinegar, or medical Vaseline. Mix well as thick pasture and apply to the wound part. Modern ointments mostly choose malt sugar, mainly because its induration can achieve the role of the drug itself and fixation, and protect the wound part. For trauma with wounds, ointments made by refining or mixing drugs and oils are used because they are soft and have the effect of nourishing the wound part. The main types of ointments include the first for elimination stasis, reducing swelling and relieve pain. So this type is applicable to patients with severe swelling and pain at the early stage of fracture and soft tissue injury, and the Xiaoyu Anglisti ointment, Dingtong ointment, and other ointments can be selected for external application. The second, for relax the muscles and stimulate the blood circulation, it is applicable to mid-stage patients with sprain and contusion, swelling and pain gradually decreasing. 舒筋活络 ointment, 活血 powder, and other ointments can be selected for external application. The third, for reunion of fractured tendon and bone. It is applicable to middle-stage patients with swelling and pain subsiding and in a good position after fracture reduction. Ointments such as 接骨 ointment, it can be selected for external application. The fourth, for warm channels and dredging collateral. It is applicable to patients with long-term injury and relapse of wind, cold, dampness, and exogenous feel. During attacks, the swelling and pain are aggravated and can be external applied with Wenjingtang oil. So, all external application of drugs that warm and disperse wind, cold, and dampness can be added at discretion in 舒筋活络 ointment. So, the fifth, for antipyrectic and detoxification, it is applicable to patients with infection of evaporation, local redness, swelling, heat, pain. We can choose Jinhuang ointment and Sihuang ointment. We can select it. The sixth, for promoting muscle tissue regeneration and drawing out toxins. It is applicable to patients whose local redness and swelling have disappeared, but the wound has not healed. We can choose 生肌玉红 plaster, red oil ointment. So, the second, precaution for clinical application of ointment. 1. We should apply an extremely thin tissue paper to the affected area to reduce irritation to the skin. Then, the dressing change time of ointment is determined according to the change of injury condition, the degree of swelling, subsidence, and the cold and hot weather. General, it should be changed once every 2 to 4 days. In the later stage, the patient can also prolong it as appropriate. The third, the ointment is generally prepared for immediate use. The fourth, if allergic to drugs, attention should be paid to timely discontinuation and gentle violent solution. 清代 ointment or 6E powder should be external used, and in severe cases, anti-allergic treatments can be used at the same time. So we will introduce the second type. It's plaster. Known as thin plaster in ancient times, it's a unique dosage form in topical drugs in TCM. The preparation of plaster is to grind the drug into fine powder and refine it with substrates such as sesame oil, yellow lead, or beeswax. Then the type of plaster. So the first, such as plaster, can be divided into treatment of injury and old dampness, such as 狗皮 ointment. Then elimination paths and necrotic tissues, drawing out toxin and promoting tissue regeneration, such as 太乙 plaster, 驼增 plaster, with powders such as 9E powder, 生津 powder generally added on the wound surface. So we should precaution for clinical application of plaster. So the first, plaster have more drug compression and are suitable for a variety of disease. General, it is commonly used in the late stages of soft tissue injuries and fractures, and should not be used if there is significant swelling at the early stage of new injuries. The second, for plasters containing pill drugs, because they contain lead tetrodotoxide or lead oxide, X-ray cannot penetrate. The plaster should be removed when performing X-ray examination. So the third type is powder. The powder is powder medicine, also known as dusting powder drug. The preparation of powder is to grind the drug into a very fine powder and store it in a bottle for later use. When used, the powder is directly applied to the wound or placed on the plaster, and then the plaster is heated and attached to the affected part. The powder can be divided into 6 categories according to its function. So, the first, for arresting bleeding and promoting healing, it is applicable to the application of general wound bleeding, and Yunnan Baiyao is commonly used. The second, for elimination paths and necrotic tissues and drawing out toxins. It is applicable to patients with wound rot and pus not exhaust, rotting flesh not removed, sinus formation, or lung granulation. So we usually to use 9E powder, 7 powder, and 红参 powder, 白酱 powder are commonly used. So the third, for promoting muscle tissue regeneration, it is applicable to the sore surface with scanty pus and new tissue difficult to grow. So when you choose 生肌 八宝 powder like this. So the fourth is for warming channels and expelling cold. It is applicable to patients with qi and blood stagnation, pain, or local cold damp invasion in the later stage of injury. We will use 丁桂 powder and 桂色 powder such as it. So the fifth, for removing blood stasis and relieving pain, it is applicable to patients with swelling and pain caused by local blood stasis after injury. We use 四神 powder and 消毒丁通 powder like this. The sixth, for sneezing and clearing channels and collaterals. It is applicable to patients who are unconscious or have a bracer plaque. 通关 powder is commonly used. So we will introduce the second type, it's liniment. It was first recorded in the Su Wen. The drug is a medical liquid that is slowly rubbed with massage, and the liniment can be directly applied to the wound or used with manipulation such as pushing and rubbing when performing tendon manipulation, or used as self-massage after hot compress and fumigation. First, medical liquid, also known as external medicine wine or external wound liquid. It is prepared by soaking drugs with alcohol and vinegar. Generally, the ratio of alcohol or vinegar is 8:2, and there are also those soaked only with alcohol. The solubility of vinegar on the drug still needs further research. So, bone-set liquid is commonly used. The second, ointment and oiling agent. The oiling agent is prepared by frying the drug with sesame oil and then remove the residue, or refining the ointment with yellow vinegar or white vinegar extract. It has the effect of warming and activating meridian and dissipating blood stasis. It is applicable to cold dampness, cold pain, and other syndromes of joint tendons and arteries, and it can also be used in the local rubbing with manipulation before and after the exercises. 万花 oil is commonly used. So, the third type is fumigation with compressed drugs. The first is hot compress and fumigation. It is a method of fumigating the affected part after boiling the drug in a pot or basin with water. First, fumigate the affected part with hot gas, and soak the affected part with medical liquid after the water temperature is slightly reduced. In winter, the temperature is low, and a cotton pad can be added on the affected part to maintain a long-lasting heat, twice a day for 15 to 30 minutes each time, and each page can be fumigated several times. It has the effect of relaxing joint tendons and arteries, relaxing strain and interstitial space, circulating qi and blood, and promoting blood circulation to arrest pain. It is applicable to patients with ankylosis, aching pain and numbness, or injury combination with rheumatism. It is mostly used for the injury of limb joints and can also be fumigated on the lower back, and the commonly used prescription can be divided into two types: fumigation formula for newly injured blood stasis accumulation, and fumigation formula for old injury, rheumatism, and cold pain. 海桐皮 decoration and 舒筋活血 location can be used for patients with newly injured blood stasis accumulation. Patients with old injury, rheumatitis, cold pain, blood stasis can be treated with upper limb injury lotion and lower limb injury lotion. Hot compress and fumigation should not be used for patients with ankylosis and musculoconstricture accompanied by an unhealed wound infection. So the second, wet compress and washing. So wet compress and washing is mostly used for trauma, and the drug is new clinically prepared into an aqueous solution for wet compress and washing of traumatic wounds. Commonly used are honeysuckle decoction, wild chrysanthemum decoction, and some fresh drug decoction such as dandelion. So the fourth types, iron drugs. Iron is thermotherapy. In this method, the drugs of warm meridians and alimentation cold, promoting qi, activate blood circulation, and relieve pain are selected, wrapped in cloth after heating, and are applied to the affected parts with the help of their heat effect on the local area. It is suitable for the new and old injuries of the lumbar spine that are not easy to be washed. So the main dosage forms include the Canlisa and compressed medicine. Compressed medicine, others such as cold salt, yellow sand, rice bran, wuzhuyu, etc., are loaded into a cloth bag after heating by dry frying for hot iron the affected part. In folk, people also heat scoring, ginger, soybean, and salt, wrap them with cloth bag, and put on the umbilicus to treat wind cold. These methods are simple and effective, and are suitable for various wind cold dampness types of tendon bone, arthralgia, abdominal pain, and urination retention. So, the fifth type is medicine strip. The medical strip is an external treatment method used for wound infection and sinus tract formed by bone disease, which is generally made of fine strips twisted with mulberry paper or cotton paper and pasted with powder of alimentation paths and necrotic tissues and drawing out toxin, such as Hongshen powder and Baijiang powder. So the sixth is iontophoresis of Chinese medicine. Iontophoresis of Chinese medicine is to extract the main active ingredients in the drug into a liquid state and determine the attributes of the charge carried by the main active ingredients in the drug. And then place the drug liquid on the corresponding electric plate of the low voltage powder supply, so as to directly introduce this ion into the affected part to achieve the purpose of treating various injuries disease. In clinical application, drugs can be selected according to different injury disease and site, and the drugs commonly used for iontophoresis include Honghua, Danggui, Chuanwu, Caowu, etc. So, we have studied the internal treatment and external treatment of drugs in orthopedics and traumatology of TCM respectively. In the latter study, it is necessary to apply reasonable syndrome differentiation to different injuries. Thank you very much. See you next time.